RFK Jr. will most likely be the top U.S. health official for at least the next 4 years.
Robert F. Kennedy cares more about human beings and health.
Are doctors paid to keep us sick?
The reality is the patients in America, they're getting sicker every year.
What is naturopathic medicine?
Talk about the differences between a naturopathic medical doctor as yourself and a traditional medical doctor.
Can Bobby Kennedy make America's diet healthy again?
Seems like there's been an explosion, especially on social media, with these influencers advocating for health without, glyphosates, seed oils, promoting an animal-based diet, beef tallow, microplastics. These are all key words that we've heard, especially recently, right? I mean, just to name a few of the social media influencers I follow, of course, Paul Saladino is one of them, Steak and Butter Gal, That Wellness Kitchen, That Butter Mom. So it seems like eating your steak and eggs on a wooden chopping board is like the new norm. Is that something you agree with?
I would say, as a naturopathic physician, I am more on the understanding of whole food and whole health. And so to me, I've kind of been in that world, and I've been promoting different, and I hate to use the word diet because in modern society, people think, oh, you have to be restricted and it has to be this thing. I mean a lifestyle change. And so eating things that are whole, healthy animal protein, it's actually shown that 45 to 60% of Americans should be actually consuming an animal-based protein. And so to me, I'm happy that it's out there in that way.
Nice. All right, Dr. Jessyca Franco-Chavez and Sam Garcia, welcome to Off Air, your source for no-nonsense news. Were you at work today?
I was at work today.
Okay, I didn't see you. I came in at like 11 o'clock.
I was in the office.
Oh, okay. So, Doctor, I was first introduced to you when I saw you speak at RFK Jr.'s rally when he was in Albuquerque. I also recently learned that you have regular meetings with Dr. Casey Means, which I didn't know. She's sort of the backbone behind the Make America Healthy Again campaign. So we'll get into your involvement with RFK Jr.'s campaign in a bit. But first, why don't you introduce yourself and your practice?
Yeah, absolutely. Thanks for having me. So Dr. Jessyca Franco-Chavez, I am a naturopathic medical doctor, 4-year accredited medical school at Sonoran University in Tempe. And I graduated in around 2017 and decided, I think I need to come back home. I need to come back and help the deficit, the patient to doctor deficit that we have, especially in New Mexico. And so per capita, I think there's 67 PCPs, primary care physicians, to every 100,000 doctors, or people, excuse me. And so that really struck a chord with me. And then of course, being from New Mexico, I just thought, what do I have to do to make this state be able to have integrative naturopathic functional medicine at a level that suits the community and suits the rural population. And so since the state was not licensed in naturopathic medicine, I was part of the core team in 2019 that got the state license. So we're licensed at the New Mexico Medical Board. We are primary care physicians. We have a beautiful scope of practice from minor surgery to pharmacologic therapy and prescribing, that of which we try not to use all the time, right? Time and place for that. But really, root cause medicine is where it's at for naturopathic doctors. And so, I'm just super happy to be here. Started running a healing facility right off the bat, and have been on a cool train ever since.
Well, that's a huge accomplishment. And then Sam Garcia, fitness trainer extraordinaire. Why don't you introduce yourself?
I am a former college athlete. I got a couple degrees at New Mexico Highlands University in Las Vegas, New Mexico. Kinesiology, exercise science was my first degree. I really got a broad scope of nutrition in there. And my second degree was pre-allied health or pre-professional health. And so during my studies, when I was really learning about both aspects of those, it really brought me into the overall scope of health a lot more. It made me understand that there are multiple aspects of how to combat chronic disease and the chronic disease epidemic that was happening in this country. And that is what prompted me to, rather than go into healthcare, which was my original plan, I decided to veer off into personal training because I wanted to actually make a difference in people's lives before it actually got to the point where they need
the intervention.
Medical intervention. And so I became a trainer. I've actually trained Gabe Salazar, taught him a thing or two. And so, so that's what got me to where I'm at now as a personal trainer. I was originally planning on going into the traditional healthcare field. That's why I got the degrees that I got, and I realized that it was sick care rather than healthcare. And like, I admire Dr. Jessyca because of what she brings to the field, because she actually gives me hope that doctors and the healthcare system are trying to prevent disease before it happens for the health of the patient, not necessarily the profit of the entity. And that was a big issue that I had personally that prevented me from going that route.
Yeah, and that's a common thread between you guys, is straying off from the traditional route of medicine and embracing this naturopathic route. So we're going to go into that. Talk about the differences between a naturopathic medical doctor as yourself and a traditional medical doctor. What kind of training is involved?
That's a great question. So I like to say it's on the spectrum nowadays, right? People get a little bit confused, and it can be confusing. Integrative physician, homeopathic doctor, chiropractic doctor. So what I like to say is medical doctor is the one that's the allopathic physician most common, right? But years ago, probably decades by this point, the DOs, Doctor of Osteopathic Medicine, came into the scene. And people were unaware what the correlation or similarity was. And with that, it's more the function of the human body, right? The more osteopathic manipulation and being able to be a little bit more hands-on. So I feel that opened the world up for a little bit more impression of integrative medicine as a whole. Even though naturopathic doctors, I like to say, and my profession likes to say, we were the original doctor before the Flexner report in 1910 with Carnegie and all that. And then the suppression happened, and it was really more pharmaceutical industry took a hold, and the standard of medicine changed quite a lot. And so I feel like we're having this revival coming back to the naturopathic medical doctor. And so what that means is that we treat root cause medicine, we do prevention. We have so many beautiful tools in our toolbox that allopathic physicians as a whole do not have, unfortunately. We get about 150 hours of nutrition, botanical medicine, and the key here is the mind-body aspect. So we get about 150 hours of that. So I like to pat ourselves on the back, because really when you put, and I've compared this at the state level, at the legislative level for our licensing efforts, you even compare an Ivy League school like Yale University to a naturopathic school, say Sonoran University, the university I attended, and our curriculum is so parallel, but we do have all of those extras. We even have extra pharmaceuticals, pharmacology, which is really beautiful, because we need to know if botanical medicines in our toolbox that we implore for therapeutic value for a patient, if there's a contra interaction or indication, we need to know about it. So we kind of have to level up a little bit more on the pharmacology, if you will. And so I would say, overall, we have to do the interview, we have to do pre-med, we have to have a 4-year bachelor's degree, and then we do the 4-year accredited program. We have to do 2 exams. We have our 2nd year exam, which is just mostly in the academic sciences. Past that, then you get to go into clinical rotations for your 3rd and 4th year. And then at the end of that, we do our NPLEX exam, which is the National Licensing Examination Board, to actually be able to get your license. And so it's similar in that degree. Do we have, what I think we could work on is we don't have a lot of clinical training as far as the match program goes to be able to have extra specializations. We do have oncology, we have gastroenterology, we have a few beautiful specialties, but it's not as robust as the standard medical doctor degree goes. And so I think we could really work on that. We could really work on having we have a placement exam, but it's more of a per school placement exam, if you will. And then of course you have to be very competitive with your GPA and whatnot. But I think if we could really hone in on those two things, we would be able to be a little bit more of the playing field, so to speak, when you're talking about, just the checkoffs.
Yeah. So the training is very intensive. Not anyone can just
think
they want to be a naturopathic medical doctor and they can be it
Oh
tomorrow.
no, so I'll tell you this, my starting class, I believe there was 130 of us, and by graduation there was 83.
Wow.
So you can understand, and it's rigorous training, it's all year round. We do quarters, so we have a couple of weeks in between, we don't really have any time off. I'm taking like 34 credit hours a quarter, and it costs about $150,000 to $300,000 just to attend school. So it's very, very parallel, and I think it's becoming more promising the more that we get people out there, and physicians like myself can have a platform like this.
For sure. And I was listening to a podcast, and Dr. Casey Means was saying that America is probably the greatest country on earth when it comes to acute care, but when it comes to long-term care, we're probably one of the worst. And like you were saying, just the idea that doctors are paid to keep us sick. Is that how you view it too?
Yeah, unfortunately, I feel because of the way that it has been instrumental in, again, like I referred to the Flexner report, it's already been bought in that way. And so the curriculum has already been established. And people don't have the freedom of choice within that model and the realm. And then talk about the whole insurance aspect, right, of the credentialing with Medicare and Medicaid. That's a whole other topic of discussion. But credentialing, that's really important because we want to make sure and help our people. And if they can't choose our medicine because it's not within their system, in their insurance system. So I think, it's something that we really, really need to work on.
Yeah, and let's talk about that. So you guys are considered licensed primary care physicians. So what kind of pay structure do you guys work with? Would it be a dumb question if I were to go to your clinic and ask, do you take my insurance?
Good question. So I credentialed with Medicaid in the very beginning, and then I sold my healing facility, and I'm building another practice as we speak. And so in this new model, in this new practice, no, I will not take insurance unless something drastically changes.
Okay.
And there's a few different reasons why. One of the reasons within my four walls is that it's really, really important to get a good person that understands coding and very capable of doing so, because then that presents challenges and potential issues to get reimbursed if it's not coded one way or the other. The second thing is that a lot of the things we want to do, there's not a code for.
Yeah.
And so if I really want to treat you as the individual whole body person and look at root cause disease, then some of the things are off the table. So here we are again, kind of with our hands tied behind our back of, well, I really want to do this, but insurance is telling me I can't do this, this or that, or else I'm spending time and not getting paid for it. And then the model surrounding it is that really to make a decent living as a private practitioner, you have to have 15-minute appointments and you have to just turn them and burn them. That's the model.
Wow.
I don't do that. I sit with my patients for 2 to 3 hours on the first initial consultation. And so really what I always say is, this medicine is mine because I hold it, and I'm so grateful to have this background and have this knowledge. And so I say mine, but I mean it humbly. To give to other people is that everybody wants this medicine, but not everybody can afford it.
Yeah.
And I say that wholeheartedly with the concerted thought and effort of moving forward through whatever structures we have in place so that everybody can enjoy this medicine, because it's kind of ironic that some of the things that we teach in this medicine don't really cost a lot, but coming to a practitioner such as myself that has a large loan and has spent X amount of years in school needs to be able to pay that. And so we ask for cash pay, and a lot of integrative functional naturopathic physicians are actually going the membership route.
Okay.
Yeah.
But it's not uncommon to see other naturopathic doctors accepting insurance, right?
So a lot of them in the state of New Mexico, we can do Medicaid. We can't do Medicare yet.
Oh, okay.
And so that's a whole federal thing. And so that's something truly, when I got this intuitive ping to really start looking into RFK Jr. and what he was doing and what that would mean for the state of our healthcare, that could be something that could be targeted, is getting to the federal Health and Human Services, the Centers for Medicaid and Medicare, and figuring out how we can do that so that every naturopathic doctor has at least the opportunity to be credentialed.
Yeah, and so talking now about both of your involvement with RFK Jr.'s then presidential campaign, I mean, you started a grassroots effort, a campaign effort for him. So what made you decide to support him?
Good question. I knew of him already. We take environmental medicine in school, and so I was already following some of the beautiful things that he was doing on the environmental spectrum, such as the Water Keepers Alliance, taking the PVCs out of the water, suing Monsanto because of the glyphosate cases surrounding that. And then, of course, he was outspoken about autism in the autism community. And, of course, those are things, as a whole health doctor, you pay attention to. And you should pay attention to, especially in this day and age with environmental causes. They seem to be wreaking havoc on our health and our bodies. And so anyway, I knew of him, of course, and I thought, heck, there's something that I need to figure out to get involved, because this is just so in line with what I want. And I really got discouraged there for a while, I'll tell you that, as far as seeing one patient at a time.
Yeah.
And you sit there and you're here for hours and you want to help and you want to do so many beautiful things for the community. And then by the end of the day in the week, you just don't have any more wind in your sail. And I thought, I need to take a pause, and I'm going to figure out how to get involved. And so, we were part of the first couple of people.
The first 3 people.
Wow.
The first 3 people,
Yeah. And Sam, what about you? What turned you on to RFK Jr.?
I was listening to a Bill Maher podcast, and I was listening to a lot of like comedian podcasts. I was listening to Theo Vaughn with Caleb something. Beautiful long blonde hair.
Oh,
you know what I'm talking about.
Yeah.
And then the next podcast that played was RFK with Bill Maher. And I was like, Robert Kennedy. And I was like, I loved his dad and his uncle's politics. So I was like, I'll give this guy 10 minutes, like this raspy voice man. And then he started talking. And then I was just like, oh. Like he had just announced his Democratic campaign in the Democratic primaries. And I was just, the things he was saying was resonating so much with me. And a lot of people my age, our age, he resonated with us because we have this BS meter. And I think we see that with the media and just a lot of things like that. And then I started talking to some of my clients about him, and they were like, he's the worst person in the world. What are you talking about? And I'm like, I listened to him in long form. Like I'm telling you, he's a really intelligent person. He's well thought out. He's well spoken. He has great ideas. He's an environmental attorney. He's freaking Robert Kennedy.
Yeah.
And they were just like, they had this impression of him. And then I felt compelled to work on his campaign. At first, it was, like we said, it was me, Jessyca, and another guy, and we just really started a grassroots movement. Like, we felt like this thing that he was creating was special. Like, when I say I felt compelled, like, I reduced my client load at work. I made less money this year. Like, I took an income hit, but I just felt like it was something I had to do. And then the national campaign actually got organized in New Mexico, and they absorbed us, which was really cool. Getting to just work and see, they really absorbed her.
Yeah.
they worked her hard, but I was, like I said, I was compelled to work for the campaign and just do everything I could, because the thing that really, when I was in college, I was doing a report, and I saw that 100,000 people die, more than 100,000 people die every year from heart disease, just heart disease in the United States. That is, I don't know, 80 9/11s. And we spent trillions of dollars in the Middle East because of 9/11, but over 100,000 people in the United States are dying. A lot of it can be prevented. And it's like, no one's talking about it. Like, in 2020, there was one person running for president that was actually talking about it, and it was Cory Booker. And so I liked him a lot, but then Robert Kennedy, and there was so much more. Like, I knew about diabetes, I knew about obesity, I knew about all these chronic diseases, but just hearing someone that knew about it too, that was in a position to actually potentially make a change, I had to it was a once in a lifetime opportunity.
And it obviously paid off, right?
And like I was telling you earlier, I feel so vindicated because we were putting in so much effort, and it felt like it was a mountain that we could not climb. Like, it was just so undoable. And when he got announced as potential HHS secretary last Wednesday, I believe it was, I like almost broke down, because I was like, yes, like the person that we wanted in the position of power to actually make change for the population of this country, not just for now, but going forward for generations, was just like
sigh of relief.
Like, everything I did was not for nothing. And
it's interesting because you consider something like health. Health is not something that should carry a political side, right? But it's interesting to see the attacks made against him when he started speaking out about, glyphosates, big pharma, his stance on vaccines. Media outlets have attacked him for being an anti-vaxxer. So what would be your response to those people?
Listen to him in long form. I was listening, I've heard it 1,000 times in the last 3 days probably. Quote unquote, there is no vaccine that is safe and effective. Stop quote. They're making sure they stop that clip right there. Because if he goes on to finish what he's actually saying, he's not crazy. He's not actually an anti-vaccine conspiracy theorist. If you actually let him finish what he was saying and explaining, you're going to realize, he actually had peer-reviewed scientific evidence to back up what he was saying. He is willing to have this conversation with anybody. During his campaign, he was taking on some of the most harsh interviews that he knew they were going to be hostile going into it. And he still took him on the chin and put out his case. But the thing is, no one is listening to it. So whenever we hear those things, conspiracy theorists, whatever, it makes me know that person has not actually listened to him in long form.
Yeah.
And
he was an environmental lawyer, right? So it was part of his job to have a deep dive into some of these issues that are affecting us.
Right.
President Obama considered him for the EPA, head of the EPA in 2008. Like, that shows how credentialed he is in environmental studies. And
I agree. For me, it's complex when you ask a physician, where are you on the stance of vaccination and the schedule? And I just say, RFK Jr. has brought up a lot of serious points that we would be foolish not to consider and not to just shove to the side, because, to your point, you're not listening to his full long form. I think he does it the best of anybody, and he gives statistics and facts and points. And you may not believe with everything every politician says, But when this person is coming out and he is standing on this limb, he doesn't have to. He's a Kennedy. He could have gone the whole other direction. Del Bigtree says it really well. He's like, he's here for us. He could have gone and had an easy, cushy life, and he's here fighting the good fight. And so, you know, for me, listening and understanding it from a medical perspective, we owe it to each other. We owe it to the next generation to make sure that we are looking at the research, creating the research in the study, and having people vet it that, you know, are beyond the control of maybe some different entities. And so I think here we are in this light of this new era, considering that we must, it is a humanitarian obligation to start studying these things.
And just talking now about the practical impacts of if he does hold that seat, what would the next 4 years look like with RFK Jr. overseeing the Health and Human Services Department?
Well, go ahead.
There would be a lot of corrupt people that are going to be held to the fire. They are, he has a PhD, he says this, in corporate corruption and regulatory corruption. He knows the people in power that are not, they're taking the interests of large corporations over the interests of the American people.
Yeah.
And like we've been hammering that point, but
But who can deny that?
That is the first thing that I think is we're really going to see is just a change of I even see it starting to happen like on certain media platforms. We're going from, the conversation is actually starting around these things that concern us. Like everybody knows obesity is a problem, but okay, here's some Ozempic.
Yeah.
And now we're actually, the conversation is actually going to get to what is the root cause of this? How can we prevent this? Rather than how do we put the Band-Aid on this broken leg? That is what our healthcare system is right now. It is temporary, like you said earlier. We are number one in acute care.
Yeah.
But long-term care, chronic, I was gonna say chronic obesity, but chronic disease just in general, I don't want to say a majority of it is preventable, but we're about to find out.
Yeah. But thinking more in practical terms, like what would it look like when you go to the grocery store if he does enact some of the things that he wants to do? Yeah.
So just overall perspective, and then I'll get to that question, but we spend $9.8 trillion worldwide, right, on healthcare. 75% of deaths worldwide are from what you just mentioned, chronic disease, whether it be cardiovascular risk, obesity, diabetes, etc. And so we can impact that without spending a whole lot. Back to your question, what do you choose every day? You choose how many times a day to put something into your body, the sustenance you need to thrive, not just survive. Making sure that we have really good quality products. We have a majority of the whole food product versus the pre-packaged preservative-laden product. I remember, probably it's been a decade, I had this shocking awakening aha moment for my own choices. And I walked into the grocery store and I started feeling sorry for myself, to be honest, because I thought, I can't have that, I can't have that. I started to regulate what I was consuming. And when you look down at it, I literally could have one aisle full of food, probably, and there's 20 to 30 aisles in this grocery store. And so that's disturbing. It should be disturbing. And I think highlighting what his movement is on the preservative spectrum, people like the Food Babe going up against Kellogg's is amazing. It's just painting this whole picture for everybody to see. And so I think with all of these people at the helm, we don't have another choice.
Yeah.
It's going to happen.
Well, I have you here. I want to get your opinion on the carnivore diet, because that's something that I've done recently. I mean, together with the Reels promoting RFK Jr.'s policies and ideas, are these health influencers promoting the carnivore diet or an animal-based diet? Is this something that you would recommend at all?
So I am very intrigued with the talk and the points made about it on social media, as you have mentioned. There's a lot of really great research done. There's a cardiologist that he is somebody that I follow, and he just talks about the carnivore diet.
Yeah.
And so do I agree that it could be something for everybody? Maybe not, because I really like to take the individual into consideration. And just to kind of speak on the blood type diet, type O people, the original hunter-gatherer, they have a beautiful time incorporating that animal protein, whereas somebody that's not of that same blood type may not digest it as well. Now, not saying that they couldn't benefit, and not saying that they should just go vegan or vegetarian, because they might be lacking some microbiome, some bacteria in their microbiome that doesn't help them digest some of that plant protein.
Yeah.
And so then here we go with all of these other problematic things we have to kind of uncover. And so I guess my answer to you would be, it always comes to the individual. If you have a competent doctor that you trust, and you can stay really committed to a lifestyle change, even if you went on the keto diet or you went more heavy carnivore diet for a while, if you're being guided and you're self-understanding and advocating for yourself, and it's making sense to you and you're feeling better, and then I like to do those quality checks with labs, right? And kind of getting all of your lipoprotein levels, your cholesterol, what everything's looking like, making sure that you may feel and seem healthy and you feel good, but just doing those checks and balances, that's really important too.
Yeah, I first started doing it just because I wanted to test what it would do with my eczema.
Okay.
And a week in, it completely disappeared. And then so I've been using it as kind of like a reset way of eating. And so I would be 5 days in on carnivore. On the weekend, I would implement more carbs, so it would be more of an animal-based diet.
Okay.
And I've had good results. I feel better. I know you told me about a plant-based diet.
So to build on that,
yeah.
Plant-based nutrition was a big part of my studying and my health degree. And so I don't eat a plant-based diet anymore, but what I do really find, because I have looked into what you're talking about, Dr. Peterson, she promotes that a lot, but it's the whole food aspect is what I've really seen is the common variable among all of these things, because I practiced a vegan diet, a plant-based diet. For a time being, I practiced a whole food plant-based diet. That is when I felt the best. What I've noticed is, to what you're saying, if you're eating beef and blueberries and eggs and cheese, where is the processed junk? Where is the chemicals?
Yeah.
It's absent.
Yeah.
And so I wouldn't necessarily say, and to her point, everybody's different. Blood type is a big deal, very big deal. If you're an O blood type, you're digesting meat just much easier than an A blood type. But it's the whole food aspect, not necessarily just eating meat, because that could lead to high levels of cholesterol.
Yeah.
Like, it really depends on that person, how they're processing it. And I wouldn't necessarily recommend like a pure like meat diet, but if you're checking your blood test, if you're working with a really qualified physician that is going to be guiding you in the right direction, it could work for some people. It really could. But this is one of my developing philosophies, because I just work with so many different people that practice so many different types of eating, and a common factor is whole food.
Yeah, I mean, there can be unhealthy vegans, right? They can live off of McDonald's French fries,
Beyond burgers. And
and then carnivores too. They can live off of processed beef jerky or chicharron or stuff like that, right? But like you said, it all comes down to the whole food aspect of it. But yeah, Dr. Franco-Chavez and Sam, it was good having you on. It was a great conversation. And thanks for just introducing me to the campaign locally. I was a reporter when I met you guys, and so had a really good interview with RFK Jr. I had the pleasure of meeting him, speaking to him a little bit. So we'll see what happens. Is there anything that you can reveal with your involvement in his campaign?
So I was the Southwest Regional Operations Manager for the 7 states of the Southwest, and that was an amazing opportunity. Met so many beautiful people from really around the world. And then now I'm on an NDA, so I can't really say anything, but I'm just assisting Team Maha with whatever they need at this point, and it's happening at the speed of light. And so hopefully we'll have some amazing, fun, great, informative developments to come.
All right, that was a nice tease. All right, it was good having you guys on again. Thank you.
Thank you.